everyone, and welcome to our Health Statistics on the Web course today. My name is David Brown, and I am joining you from Laramie, Wyoming today. I'm part of the Region 4 NNLM group, and we're going to just talk about health statistics today. We are part of the network of the National Library of Medicine, a seven-region organization that spans across the country, focused in 7 regional medical libraries, and each one offers different programs and services related to health information, access to health information, health knowledge, and the like. So what are we trying to do today? We're trying to recognize the difference between data, data sets, and statistics. Each are unique, and each will help you as we go along. We're going to understand a 4-step process used to locate relevant health statistics for a particular circumstance or issue. And we're going to identify online resources that provide data sets and statistics at the local, state, and national levels. So again, a little bit more hands-on. Hopefully I won't be talking the whole time, but I will be doing a lot of demonstration as well in this presentation. So what are we going to go with here is we're going to have some statistics overview. What is data? What are statistics? What are some key features of health statistics? How can we use these statistics with our different populations? Again, we have a variety of populations. We have librarians here. We have public health people. We have a variety of people. So how can we use these in different ways? What are some steps to finding health statistics and data? And where are some of the sources, such as our portals, our national, and our local? Again, a lot of information, but we'll make it fun and try to make it as enjoyable as possible as we go through on this. So as we dive in here, the whole idea of data, data sets, and statistics. So data is our raw numbers. It's just a count of individual events or services. Again, just because we have data doesn't mean it's quality. We're not knowing anything about it. It's collected at multiple levels, and we do it. A data set is that data collected and arranged logically according to a definitive criteria. So again, we're putting our data into an Excel spreadsheet or an SPSS or a SAS or any of those number of ways of doing it, then we're creating a data set. It's a major unit of data storage and our retrieval. So again, we want to have it, we want to make it usable. We use these tools to be able to do a little bit of analysis with it. And again, the problem with data sets is they're not always fully representative because it's only the people we've talked to, only the people we've looked at, and only the people we've used in general to use it as we've looked at it. And statistics is the analysis. So again, it can be presented in multiple arrays of ideas. It can be text, figures, graphs, maps. Again, lots of ways to present statistics. Again, depending on the data set, sometimes the statistics may be a little biased or they may be more honest than we want to be. And that's okay in general. And most data on websites are compiled statistics. So again, even though they're going to say it's a data, it actually is usually compiled analysis of ideas in general. So I hope that gives you a good overview of what we're going to be talking about today. So again, as we said, the statistics are a numerical summary of measures. They're usually population-based. So again, it's based on a population. So whether that be number of patrons coming into the library, number of people getting a COVID vaccine, number of people attending an exercise program. Lots of different ways to look at these things, but it's usually based on a population level. They measure a wide range of health indicators with varying source of data. So again, if we're trying to answer a question, a larger question, we may use multiple data sets to try to get to that answer in general. They're collected and analyzed over a period of time because again, things change, data changes, people experience different things. If we were to have done a study on mask wearing pre-COVID and post-COVID, we would have completely different data sets and completely different data to look at in general. The point to remember, statistics are collected to meet the needs of the collector, and that's one thing we always have to be aware of. Who is paying for this or who is doing this and why are they doing it? What are their intents of collecting this data? And again, sometimes we have to be mindful of that and sometimes take some of it with a grain of salt. Some of it may be very high quality and very reasonable. So again, or as another way I like to look at it too is statistics don't lie, but statisticians can in general. So how can we use these? We provide information about the health of the population. So again, are we trying to understand the disease occurring? Are we trying to gauge health disparities? Are we trying to just understand what's going on with our population? Are they using services? What services do they want? It could be on a needs assessment, it could be an evaluation, many, many different ways of looking at these ideas as we go along in these areas. They can guide policy development. And this is one way that we as individuals can advocate for change. If we get some data, if we get some stats, if we get some ideas, we can really try to push some policies forward to make some changes happen in general and move things forward. And we can do this for public health program development and evaluation. We can support funding because we can say, hey, this is a problem. We know it. We have people that want this. So give us some money to work with it. We can show if the program is improving the health, and we can help a developer know the best topic for a program or policy. So again, lots of good quality here. Most of my sources here are coming from Essentials of Biostatistics and Public Health from Jones and Bartlett, cited at the bottom. So again, if you're more interested in exploring those, please do. So now that we sort of have a background on what these are, how do we find these things? What are they? Where are they? Where are they housed? What are we doing for it? So the first thing is we have to formulate a question. Again, if we go back to our basic research classes or our basic idea, we have to find a research question that we can use, what we want to use, what are we trying to do it. Then we have to choose those resources that are the best for the question. And that's where our librarians and our library friends come in and are very helpful and work across these ideas to help us find these materials. Then we have to evaluate the results. So what did we find? What do we have? How do we assess it? How are we going to take this and make it meaningful to our population, to who we're trying to our constituencies, or to us individually? And we have to repeat this a lot because, again, data and statistics change all the time. So we're always gathering more information. We're always looking for new ideas. So these are the first primary steps that we take to move this through these ideas and work us through these thought process. So I will slow down for a second, make sure everybody's hearing, and make sure there are no questions at this juncture. Looks good. All right. And like I say, if you have any questions, need clarification, please type it in the chat. We will respond to them as we go along. So we are going to talk about some of our portals now. So there's the National Center for Health Statistics. This is a great resource, a lot of general information. It's that principal health statistics agency for the United States. It provides information and to support actions and policy related to health of the American people, and it brings together data from a number of quality sources. So I will go over there and share. All right. So this is our National Center for Health Statistics website. Again, a lot of information on COVID right now. Lots of good surveys that have been recently completed. The Health 2019, which looks at the overall of the health status in the United States. Going on, like I said, what's nice is they have these stats of the day, which are great places to come and see where it's going on. And they're talking about the largest decline in suicide during 2020 was in April, concluding with the first spike in the number of COVID-19 deaths. So it's interesting to see these things. And then what's nice is there's even further portals that you can go through. So if you're looking to give information to the general public, there's things there for people who are survey participants, for the media, for researchers, and our students and librarians. So a great portal here, lots and lots of high quality information, almost probably too much information, but it's a great place to start. It's that highest level place to look and find materials and use and look at you as you go through these ideas and ideals as you go forward. All right, so again, a great resource, a great place to go, and a great place to look in general. Another thing that we love to talk about is Medline Plus, one of our primary products for consumer health information that's produced by the National Library of Medicine. They have some very good topics pages, so go over there. And again, so if we go to our health topics, which again are at the top here, you can see that it says health topics. You come here, and then you can get very specific information on a health topic and some very specific statistics. So if we look at, for example, genetics and birth defects, we can click on that. And we can go down to birth defects. And you go here, you can get to the statistics and research. And all the statistics and research, again, it's going to take you back mostly to CDC or NCHS, but it's very topical. So again, if you're not wanting to just dive in through CDC or National Center for Health Statistics, you can go right here and find these information. So all those statistics and research are available to you by topic. It's a great way to find some information, especially if you're doing a research project or you have patrons asking questions about a certain disease or a certain idea. It's a great place to look. It's a great place to go. And it's just a wonderful place that we can definitely use as we go along. So again, we can click on another one here and it takes you right to it, give you some very specific information, very usable, very easily cited, easy place to find information in general. Now, there are local and state locations. So if you go to the Wisconsin Department of Health and Human Services, they're going to have a section on data and statistics. Or if you're looking at the state of Louisiana, there's a Louisiana Health Report Card from 2017. Or there's even city level things like Healthy Chicago or Healthy New York City or Healthy Los Angeles. Again, different places to look, ways to find information very specific to local information. Again, if you're looking more nationally, you're going to go more for CDC, NIH information. If you're going locally, there might be some local information that's out there that has been compiled and used by the state and local health departments to give you high quality information. So as I said, we have some national statistics. So the first one is our BRFSS or YRBFS. It's the Behavioral Risk Factor Surveillance System. There's also a youth one that looks at children ideas. It's sponsored by the CDC and other federal agency. It's the world's largest continuously conducted health survey. It contains international results as well. Again, not completely, but it's mostly focused on the US. There were over 400,000 surveys completed in 2020. One thing I will say is it's a great tool if you're looking at specific things, but not all questions are used every year. They have to keep it a shorter telephone interview that can be done in about 20 to 40 minutes. So not everything is examined every year. So again, if you're looking for stuff, you may have to go a year or two before to find those specific questions you are interested in or you are engaged in that you are looking for in general. It collects those self-reported data from all those in all 50 states, DC, Puerto Rico, Guam, the U.S. Virgin Islands, America, Samoa, and Plateau, on their health behaviors, their chronic conditions, and the use of preventative services. It's a great place to find high quality information, at least in the raw data set that you can further analyze as you go along. I will here to our BRFS. As we look at it, again, there's the questionnaires are here. It's about it, the publications and resources, the fact sheets, the sortable stats, all sorts of good quality information that is here. Again, if you're looking at prevalence data and data analysis, it's right there. But if you want to find a specific questionnaire, they are right down here. And this is the exact questionnaire that was asked, and it's a PDF that you can easily download. And you can find what was asked, what the different sections were in a nice analyzed portal. You can also find the raw data if you're looking for it, but these are the nice summary, executive summary ideas that were done and what questions were asked and the process and skip logic that was used to do these different things. So it's a great resource that you can look at. It goes all the way back to 1984. So again, if you're doing a historical study or you're looking at history, it is all here. And then again, they have their statistical briefs as well over here in general. So again, lots and lots of information here, lots and lots of good quality idea. And again, if you're also looking for maps, they also have some GIS mapping as well. So again, lots of different ways to present the information, lots of different ways to look at it. Again, just great resources. You can spend days, if not hours, going through all this, getting the data, looking at it, playing with it, analyzing it and doing it, and really just finding what you want as you go through in general. So that is our purpose. Then we also have state health facts. And these are from the Kaiser Family Foundation, another nonprofit organization that really does a lot of good work on gathering information. It provides data on the state at the state level on over 800 health indicators, including demographics and economy, women's health, minority health, health insurance, and it gives you some custom state reports to download the indicators of interest. So again, it is a great resource here. So again, if we're looking at a specific state, let's just hypothetically choose Tennessee. Here, you can get different issues, specifically on COVID, Affordable Care Act, disparities, health costs. So if we want to look at disparities, we can pull this up. It can be specifically to COVID disparities, health coverages, births, mortality, all sorts of good data here, all sorts of good statistics in general that we can look at. On HIV, the woman, again, men's health disparities. Again, you can pull it up. It'll pull up a usable idea here of table, and you can refine the results as you go along. You can also do it from a map perspective, more a national, looking at it from a national perspective. Lots of good resources here, and you can also change that. But again, lots of good materials, lots of good places to look, good places to provide, good places for people to look for just good information on national health issues, and you can definitely find what you're looking for and work through it as you go through it. So it's a good resource. You have a lot of resources. They are high quality, and we definitely use them as we go forward. So we've talked about national health statistics, which are great for big studies, large ideas, good getting a baseline of an understanding of what's going on. But a lot of what we're working with, at least librarians, at least a lot of public health people who work at state and local public health departments, are going to be very much more interested in local statistics. So what's going on at the local level as we go along. So the first thing we have is our census data, which is great because it goes down to census tracts, which really knows what's going on with Americans, peoples, places, and their economy. And it provides this fact finder where the state, the county, the city, the town, the zip codes, the census tracts, all of that stuff is available to you as you go forward. Census. So again, you can just type in anything you want. You can view the tables. There's all the maps and visualization in general. So again, if we want to, you have different city profiles or the United States profiles. In general, you have micro data. You have all this, but if we want to just do a United States profile, general, here, and we want to know the U.S. as a whole, our population and people, but if we're going specifically for health information, this is nationwide, 12.7% of people have a disability. What's the fertility? And we can further go down and look at these things. What's going on? How is it working? Also, you can put in your margins of error, which again, we need to get into. But again, and where does this come from? It comes from a table and where it was the estimate and what we can use to look at it in general. Fertility, all sorts of good information, population without health coverage and where it's gone historically. It's great, great, great information in general as we look. And then, like I say, we've got all of our maps here. Populations, there's all sorts of ideas. You have you can do a lot as you work, and you can look at and further customize your maps as you go forward. It's a great little tool. Again, depending what you're trying to do. Again, a lot of this, there's a lot of information out there, but it's making it relevant to your population, to who you want to work with, and where you want to go. Those are the key ideas that we look at and work with in general. And as we look through it, we hopefully can use it in general as well. Then we have our county health rankings and our roadmaps. And these are great, especially for local information, because again, this is the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. This is how health is influenced by where people live, work, and learn and play. So again, really looking at the idea of a place matters, or where a person is has a big impact on their outcomes and their health status and where they're going as they go along. They have these county level factors such as quality of life, what are their health behaviors, exercising, smoking, drinking, all those things that we look at, social and economic factors, so what's going on from a social and economic perspective, and what does that physical environment look like? Is it can you walk? Are there walking trails? What are we doing to understand where we're going as we go through these things and really use it as generals? So what's nice here, as this is local, We can explore the health rankings, look at the 2021 measures. So we can look at, for example, adult obesity, and can explore your data, go by state. So you can say Georgia, for example. Breaks it down by county, what the trends are, what's going on here. We don't have to get into margin of error, z-scores, not what we're talking about today, but in general, a lot of good information that you can find. And again, you can download this. You can compare amongst it. You can compare counties against each other. There's a lot of ways of looking at it. So if you wanted to, for example, compare Arizona to Arkansas, you can easily do this by count on a county level. Lots of good things, or even within states. There's lots of ways to do a lot of different things, a lot of different ways. Again, you can take it back historically if you want as well. And you can do other states and ideas in general. So like I say, have all your maps as well here that can help you understand. And again, lots and lots of good material that you can use at a state and local level. So again, there are a number of ways to do it. You can also look at the overview in general, how to use the data, measures, again, all available to you, no charge, great resources to find and great places to find as you look at it in general. Then we have our City Health Dashboard. It's created by the Department of Public Health and the School of Public Service at New York University, in partnership with the National Resource Network. They have 36 measures of health for the 500 largest cities in the USA. Some data can be filtered to the census tract level on measures aligned those with the community health research ideas. So again, what can we say? It might not be the best for rural health, but it definitely does work in urban areas. You can find a lot of information. You can look at it. We can definitely go over there and share our city health. So if we want to type in a city, Salt Lake City, Utah, where our NTO is based, you can pull up all sorts of health outcomes, breast cancer risk, COVID risk, obesity, what's going on with the health behaviors, what is the physical environment, what does the clinical care look like. Again, lots and lots of good information at a city level. So again, if you're in a city library or at a city health department or at a state, you can find these informations. There's lots of good information. You can go very specific metrics, or you can just go to the view, a general overview, so you can see what's going on in general. Again, against the national averages and versus, the census tract values. So again, you can see where things are, comparing, telling people where things are. It's a great idea in general, where things are, what we're doing, where things are going, and what's going on. So again, it is a great little tool that you can use. Great place to send people if they're looking for just general information. And that's where we look for and what we try to do in general. You can do your demographics as well. So again, not all the data may align because it just depends on the data they're gathering and where they're gathering it from. So don't be surprised if you see different numbers in different places. It's the way they got it, the way they analyzed it, what data sets they used, who they interviewed is going to make differences in this. So don't expect to see everything being exactly to the 10th or to the 100th place being exactly the same. So again, and that's okay. Again, it's just giving you ideas. It's letting you have the information you want to look at and where we want to go on an urban level to work through these ideas and thoughts and what we're trying to look at as we go through these things. Like I say, lots of fun stuff, lots of good information, lots of ways to really look and make things work in general. And then for our rural health individuals, we do have a Rural Health Data Explorer. And this is the National Clearinghouse in Rural Health Issues. You can view the statistics for metro and non-metro counties and see a variety of metropolitan classification. The statistics are from publicly available federal resources and include information on demography, health disparities, social determinants, and access to health services in general. We have some slides on this, but I'm going to also just go over there because I think it's better to show it live rather than not live so we can make mistakes and learn from it. So this is our RHI hub. Lots and lots of ideas, and here's the Rural Health Data Explorer, where we can explore what's going on, again, all the way back from 2009 to 2019. And again, depending on what indicators you're looking at, population under 25, geography, health disparities. So, and if we want to look at physical inactivity from 2019, and if we want to select specific states, say, let's say Montana, which is a fairly rural state, it pulls up all of these ideas and by a county level, percentages. Also, you can do it by non-metro versus metro areas. Lots of ways of looking at this. Now, again, their data is only from 2017. So not everything is always most current. It depends on the state when the last information was available. And again, it does it this. You can make graphs on it. You can look at the comparisons between metro and non-metro. Not a big difference here with leisure time in general. Again, some places show higher, some places show lower. Again, lots of different ways to look at it and look at it in general. You can get a lot of high quality information, a lot of ideas as you want to look at it, and it's nice to visualize it because a lot of times we can talk about numbers, but if we don't see it, it doesn't always make the most sense. There's also a chart gallery here, which is very nice in general. So if we go by state, let's go with Kansas. In general, you can look at very specific maps that have already been done. You can look at your populations. You can look at these ideas in general. Over 7 pages of these things that have already been done. You can also create your own. So again, a lot of high quality information, a lot of great places to look and do. There's case studies. There's a lot of stuff here for the rural health if this is stuff that you're interested in or you're trying to find in general. All right, so as we see, we did that Rural Data Explorer. It pulled up this very large map of ideas here. It's a great place to go, and we can definitely look at it by metropolitan area. Otherwise, as you go forward, you can also, like I say, number of physicians per 100,000 people in a specific area. And you can look at counties in Georgia, all over the country. And now, okay, so now we're getting to the point where there are some additional tutorials and things. Like I say, this is much more a survey of what's available and what's out there and places you can go and use and find what you want to use. So again, there are additional trainings. The one is the statistics tutorial where it's really going to go much more in depth. You can find them. You can find what's going on. It allows you to find these health data statistics. Again, there's a lot of different materials. It's a great additional training if it's something that you're continuing to be interested in as you go along. And then we do have a great book from from our NCBI, which is free, open access, available to you. It's a little dated from 2008, but a lot of stuff in statistics doesn't really change. And basically, it's this Know Your Chances book. It's written by Dr. Schwartz and Welsh, and it really talks about risk, and it talks about why we use this stuff, how medical statistics or claims are based. It's great. It's free. You can go on there and just download copies of it or read it or find out more as you go along here in general. So, on that. So I know I have a lot of time here. If you would like more demonstrations, I have time to do it. I just wanted to make sure I got through the material that was supposed to be covered, but I would like to ask questions. Please feel free to type them in the chat. Feel free to ask away. Like I say, there's a lot of material here, but I do know we try to make it as accessible and as usable for you as you go along. So. Let's see, I got a few questions coming in. Oh, the name of the book is Know Your Chances. And again, it's through NCBI. I can go back to the slides if you'd like to write that down. Maybe. There we go. So yes, it's the Know Your Chances book. Understanding Health Statistics. ISBN is down there as well. So should hopefully help you. I'll leave that on the screen for a second. All right. Okay. And can we talk about how we can cite the sources? Yes, sure. Again, anything you find should be able to be cited. Now, again, it might not be the easiest because, again, a lot of this data comes from other sources. So you can also go back to the raw data and cite it that way, or you can cite it another way in that you can cite it that it's a map. So like you say, if you got the map from the rural health information people, you would cite the map as that came from the rural health. Oh, you didn't see them. Okay. I will go back and redo those. I'm sorry that they did not come along. So, all right. So can everybody see it now? All right. So the first one is that finding and using health statistics. That tutorial from the NCHS. It's a great place to go. You can do it on your own time, not just in an hour long idea. You can find, and again, it's more of a general course. It's again a survey course, but it gives a little bit more detail. It goes into looking at these things, lets you test your knowledge as well as you go forward. The book, Know Your Chances here, is here as well. Again, available from NCBI bookshelf. It's out there. There might be others as well, but this is the one that's probably the best and going to be the most current that's available out there as you go forward. And as I say, my name is David Brown. My email and my contact information are here. If you have further questions, we do have and I know Sarah's putting in the chat there that you can download these slides if you want to go back and look at them. More than happy to spend some time with you because I do want you to feel that you're getting your experience here and that we're working with you. And again, we are here to help and support you in your needs from NNLM, and that's what I can say. Any other questions that I can talk about? Back to citing sources? Sure. All right. So, okay, back citing, like I say, you can, Carol, if you have a specific question on that, you can definitely contact me. I do have more information, but for the most part, what I will say is there's ways of citing it. It just depends on what it is. Again, APA is going to be, again, and also it depends on the writing style. Are we using MLA? Are we using APA? Are we going to use Chicago or Turabian? Each one of these. And is there a good way to search for LGBT data? Again, it is going to be in those resources that I talked about. There's not a specific a site that we talked about today that has LGBTQ data, but there is data out there. CDC and NIH provide wonderful resources on that. It's become much more prevalent, and the studies are being much more inclusive with the LGBTQ communities. And like I say, it depends on as we were talking about citing of sources, it depends on the style you're using. It depends on what the audience is too. So again, if you're just trying to give general information, you can do much more general citation. But if it's a citation for a research project or a paper, it might have to be about COVID-19 statistics from Johnson. Now, and that's the thing. There are many different sources because the CDC, everybody uses a different definition of how they're going to use their COVID data. Some places have much more higher reporting. Some include suspected cases versus confirmed cases. Again, you have to look at what they're using to make that data statement. So yes, those numbers are going to be different. And that's the thing with COVID is that, are we only using laboratory confirmed cases? That's going to be a smaller number than suspected or probable cases. But again, over time, hopefully those numbers will all even out, but they may not either because you're going to have differences between deaths and differences between all of these things because, again, the data is constantly being updated. And how CDC gathers that data and local health departments gather that data may be slightly different than the way Johns Hopkins or other sources to gather that data. So again, and the thing is, it changes daily. because we're getting new cases of COVID and new deaths of COVID on a daily basis. So yeah, there is going to be variance in that, and that's an acceptable idea. As we look at all sources. So again, and you'll even see differences between different state websites with Hopkins reports and CDC at times. So don't feel that you have to have the most current data. Just know that the data is out there. Any other questions here? Margin of error. There is a lot of error because again, it depends on how it was gathered, and we know that the 2020 census was not gathered the most effectively because we were in the middle of a transition with between two different administrations that we looked at. And again, and some of the stuff might not have been gathered as effectively as possible. Again, that's the thing. A census is what it is. It's who's available and who turns in the information, right? So again, there's always going to be an undercount in the census. We're never going to have the exact numbers that we can have in any census because things change. Rarely are we going to have overcounts because again, the way it's stringent, you're going to know if a person's that you're over, but it's very easy to undercount certain populations and undercount individuals based on a form that people are sent or a phone call they receive or a person coming knocking on their door in general. All right, sources and translating data using social math. Not that I'm aware of. That doesn't mean we can't definitely look for them as we've done good. Is there a specific state? I don't always know. I would say you have to realize that unfortunately state departments of public health can be a little bit more political than they should be. I would say probably the best place to get the data is, if you can, try to get it from as most independent sources as possible. Whether that, and again, every state presents their data and there's mandatory stuff they have to present based on CDC guidelines and NIH guidelines. But at the same time, just depends what you're looking for. I think a lot of times the city data is usually the best presented because they want to prioritize their city and they want to showcase their city. But at the same time, you have to be aware that, again, sometimes it's who's presenting that data, what's their idea, what are their statistics, what are they trying to share, and what are they trying to show in general. And like I say, I don't have one specific state in general. I know, and I will say, states that are better funded in public health usually have better statistics, and that tends to be on the East and the West Coast. So Massachusetts, New York, New Jersey, California, Oregon, Washington, they usually have a lot more funding and a lot more information that's coming to them about health, and they're gathering more data and trying to present it as a more usable idea in general. I really do appreciate all of you coming today and working with us. And like I say, statistics are fun. It's a lot of stuff that you can spend days and hours on it. And you got to realize, even as we've looked at it and we've worked on it, we really do want to push you and encourage you to look, explore, use these resources, share them with your populations of interest, whoever those are. We really do want you to feel that there's resources here, and also reach out to your RMLs if they can be of further assistance with this, or myself. Because again, we always want to make sure that you have access to this high quality information. And that's really what we're trying to do in general, is push that information out, make it accessible, and make it really meet the needs of our communities that we serve. And that's what the Network of the National Library of Medicine is here to do, and we are aiming to do on a regular basis. Yes, and you will get the CE. We will post a link in there, and Sarah just posted a link to your evaluation. It should take about 4 to 5 minutes, and be sure at the bottom to clarify that you are seeking CE, whether it's for CHES or MLA. We do have those available for you, and you should be available, and we really do appreciate it. And like I say, I can hang out for a few more minutes here, and we will definitely see where things go. Okay, so Gwen, so again, Medline Plus is updated regularly. Again, it's not necessarily always always updated because things change so rapidly in the healthcare. But again, they try to go through it on basically an annual basis. We do offer courses that explain a little bit more about Medline and trainings that are available out there either on demand or webinar based. So definitely look at it, but it is updated with frequency. Again, it's just not always so quickly because there's so many health topics out there and everything has to be reviewed and we have to find the information. It's got to go back through the publish and the peer review process. So it is a slow process to update, but we are always trying to update it and make it as relevant as possible. Yeah, and yeah, things may not have been updated for a few years, and that's true. And sometimes there's not funding priorities in those areas, so some of that data may not be up to date either. Yeah, yeah, there are data. It just has to be found. You just have to find it at that level. Now, again, not everything's going to be, but like I say, your national health statistics locations, or if you're looking at cities, there's that city data and there's that rural health information as well. And you just have to dive in there and see what's available. Not everything's going to be there, but then another place to go to is if you're really interested in something, you really want to know something, contact your local or your state health departments because they have a lot of that data available and you may be able to find it there as well. Software to comb, again, that depends. It depends what you're trying to do. If you're just trying to do basic cleaning, you can just use Excel. Excel is a very powerful tool if you're just trying to do some basic cleaning, and it's usually very readily accessible to people. But again, if you're trying to do a little bit more with analysis or trying to create subscales and all, then you may want to use like an SPSS, a SAS, or one of those. And again, it depends if it's quantitative data versus qualitative data. Because again, if you're doing qualitative, you may want to use some in vivo or other sources as well. But like I say the best place to start is just with an Excel spreadsheet. Well, very welcome, and thank you again for spending your early afternoon, late morning, early afternoon, depending on the time zone you're in.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.